Hello, and welcome to the Public Health, a product of the Alameda County Public Health Department. I'm Dr. Tony Iton, the Public Health Director, and today we've got a great show on integrative medicine. We have three real experts that we're delighted to have in the studio today to talk about this complex but exciting subject. First, we have Dr. Stephen Chen, who's a physician and an integrative medicine specialist at Asian Health Services in Oakland. Welcome, Dr. Chen.
Thank you.
We have Gregory Ross, who is a licensed acupuncturist and a practitioner in the chemical dependency unit at Highland Hospital. Welcome, Gregory.
Thank you, Dr. Iton.
And Dr. David Liu, who's a professor at the Institute of Chinese Culture and Health Sciences in Oakland and a longtime experienced licensed acupuncturist in the Bay Area. Welcome, Dr. Liu.
Thank you.
I'm going to start with Dr. Chen. Dr. Chen, you're a doctor and you practice complementary or integrative medicine. How did you get into that, and why do you think that that's important?
Well, I actually had developed an interest in, I guess, what we're calling complementary or integrative medicine prior to going to medical school. It started with my grandfather. He was a farmer, and he would make different herbal concoctions and try them on us. And it was an interesting experience, and I had always felt, well, there must be something here. And then I went off to medical school and learned the conventional medicine, and fortunately was able to, after training, get into a fellowship at the University of Arizona and study with folks like Dr. Andrew Weil, who founded the program. And that really kind of moved me more into how do we blend various systems of medicine. Really, how do we blend healing for the patient?
Interesting. So did you find that there was something missing in your traditional Western medical training that integrative medicine would allow you perhaps to offer to your patients?
Yeah, that's a good way to put it. I think no system has a monopoly on health or on healing. And allopathic medicine, conventional medicine, Western medicine, whatever you want to call it, is a powerful approach. But there are certain things that we haven't done as well, such as nutrition or how to handle pain or certain mental health conditions. So there's a lot of different things out there that can address these problems that are tough to treat in the clinic.
So tell us how you blend these concepts into your practice and the larger practice of the other doctors at Asian Health Services in Oakland.
I guess let me first start out with some terminology. I think it's helpful for our listener or our viewers to understand integrative medicine, say, as different than maybe complementary alternative medicine. I like to use the definition that the University of Arizona uses, which is integrative medicine is a healing-oriented, patient-centered approach to taking care of the patient. And it takes into account the body, the mind, and the spirit. Mm-hmm. And it really takes into account all the available and appropriate approaches to healing, conventional and alternative. Mm-hmm. So this includes nutrition, this includes exercise, this includes herbals, medicines. So that's the baseline in which I would start. I try to blend this into my care whenever I can. If I see a patient that I've already done the traditional conventional workup for say neck pain, and there's still a lot of musculoskeletal component to it, I start thinking from maybe an osteopathic perspective, a manipulation perspective, and I, in my fellowship, was able to learn some of this and apply some of this in the clinic.
Oh, fascinating. So the patients come to you with these issues, and you are actually looking at them through a number of different lenses.
Correct.
Do you tend to put these in sequence? You do the Western approach first, and if that doesn't work, you go to other approaches?
You know, that's a really good question. It depends on the patient. Clearly, if there's something that I'm concerned about that is a high morbidity or mortality question, I'm going to go with what I've been...
A serious disease.
Serious disease, yes. Mm-hmm. I would really want to rule out the serious condition using the things that I'm used to, mm-hmm. the conventional approaches first. Mm-hmm. If the condition has a little more time, there's not going to be as many things that we're going to do to help it make it better, then I can try some of these other approaches.
How receptive have you found your colleagues to be around these other approaches?
I think it's challenging for conventional medicine doctors to really understand what integrative medicine is. It's not been part of our traditional education. But in general, I work with a great group of docs who are very open And we have an initiative we're going to propose that we're going to put into place at Asian Health Services.
Tell us a little bit about that.
Yeah, so Asian Health Services is a community health center, and we serve the underserved in Chinatown, multi-ethnic, linguistically isolated patients. And we are going to do a dual initiative, an initiative where we're going to create a half-day clinic where we provide services to patients, first for osteopathic manipulation conditions, or conditions amenable to that, more musculoskeletal. So we're going to provide a service for the patients who have musculoskeletal conditions that haven't been well addressed. At the same time, we're going to cross-train some physicians in these modalities, and we have a professor from the local osteopathic school who's going to come and do some precepting for us. Later on, if that shows success, we're going to move into acupuncture and also cross-train some of the doctors who have an interest in this to develop some musculoskeletal-based and more medical acupuncture.
So you're really trying to take the best of the Eastern medical approach or health approaches and blend them with the best of the Western, and see where there's an opportunity for those two things to work in harmony. Is that accurate?
Part of it is that it's not only Eastern, though. Osteopathy grew out of the American tradition. There's Western botanicals, there's energy medicine, there's mind-body medicine. So it's inclusive of various systems of healthcare. Ayurvedic medicine.
Mm-hmm. And what drives this? I mean, you're a clinic that offers sort of the traditional sort of clinic services. Why are you moving in this direction? Is this a demand issue from patients? Is it a frustration with what you're able to treat and cure?
It's multiple reasons. Part of it is demand. Our patients already use various forms of medicine that are not conventional. They're often going to acupuncturists when they can and when they can afford it, or herbalists. So it's already out there, and we need to understand that as providers, as their primary care providers, especially if they're going to have cancer treatment or something, because there are interactions. Then there's also just the day-to-day that we see in clinic. As providers, we know there are conditions that we don't address effectively: pain, anxiety, nutrition, diabetes, sometimes beyond just the medical route.
Well, before we go into our next segment, is there anything else you'd like the viewers to know about what's going on at Asian Health Services?
Well, I think at Asian Health Services, we're really trying to be of service to the community and to communities where they haven't had as much access to all of these services. And so one way that we're dealing with it is to try to bring it all in-house and to bring some of these integrative medicine modalities and approaches to our patients in a cost-effective way. And we hope to be successful.
Well, thank you very much, Dr. Chen. That sounds wonderful and challenging to try to blend all of these different approaches to health together in one setting. I'm sure your patients are very grateful that you're taking these approaches. We're now going to go to a roll-in with an herbalist in Chinatown in Oakland to understand a little bit about that practice and the implications of that for health.
Yes. Okay. What kind of the training did you receive in herbal medicine?
I'm the first generation in my family doing this kind of business. Yeah.
So what are some of the herbs you use the most here?
The licorice root
Thank you so much.
Yeah.
tastes very good, sweet.
Goes fast.
See, that's in this
No, it was great.
prescription. This one,
What's
Angelica, Dongguai, the very important female herb.
Where do the herb come from?
Most of them they import from mainland China, except those from Wisconsin, American ginseng.
What kind of the medical problems do this herb treat?
This for help the circulation, release the pain, and good for itching.
How do patients get prescription for these herbs?
They need to come in personally, then we see their tongue, check their pulse, and listen their complaint, then decide what combination they need to have.
Normally, how many herbs for one prescription?
Usually from 15 to 20.
How long does the patient have to take an herbal prescription?
They all depend on their situation and their problem. Some maybe just take a few package,
So,
for a few days,
what is the benefit of using both Western and Chinese medicines?
They can help them heal better and quicker.
Do they make a tea?
Yeah, make tea. They're using 4 cups of water
As an expert.
and put those in and bring it to boil, then simmer until they have 1 cup left. Taste not, sometimes some herb tastes very bitter, some taste sweet.
Some masks are works of art, others are for fun.
Some masks protect you, others protect those around you.
Airborne droplets from your cough or sneeze can expose others to influenza.
Use tissues to cover your cough, and if a flu pandemic arrives, please cover your cough with a mask.
For more information about pandemic flu, visit pandemicflu.gov or ACPHD.org. Brought to you by the Alameda County Public Health Department.
I'm a senior citizen, and I'm definitely getting enough. Water, that is. To prevent dehydration, I drink 8 glasses of water a day. Fill her up, dear. Most of us need 6 to 8 glasses a day. Ask your nurse or doctor how much water is right for you. Make sure you are getting enough. Cheers.
Okay, now let's look at the teaching of integrative and complementary medicine. Dr. Liu, who's got 30 years of experience both teaching and practicing alternative or complementary medicine, excuse me for using these terms interchangeably. Tell me what some of the challenges have been for you since you've been acting as a professor, educating students in this field.
Yeah, actually, I have the teaching family. My grandfather, my father, my mother, and my brother, and my uncle, all of them medical professor. So maybe I have the gene to there. After I immigrated to the United States 20 years ago, I teaching Chinese medicine at the Acupuncture Science in the Academy of Chinese Culture Health Science in Oakland. Our goal, we want the people understand the acupuncture is a whole medicine systems independent to the Western medicine. The acupuncture have their own philosophy, and they use a different, the philosophy and different angle to diagnose disease. And that's why we teaching the students use the different way to diagnosis and teaching.
So give us an example of the philosophy. How does it differ?
Such as the acupuncture and the Chinese medicine most emphasize the balance, like yin and yang balance, such as relate your emotion and relate your whole world, and also relate your body. So we try to use the harmonizing way and balance the yin and the yang to fix your problem. We find that the most of the problem is from the yin-yang imbalance.
Imbalance.
Yeah.
So tell us about the spectrum of what you refer to as Chinese medicine, because it clearly includes acupuncture, herbalism. What's in that range of practices?
Actually, in California, licensed acupuncturist Scorpio, they cover both and the acupuncture practice and the herbal practice. The acupuncture means use the needle to insert certain points. These points, we need to learn that. Certain points to do physical stimulation and cause body have some response, means called a qi energy response, to get some the chemical exchange to fix your problem on. No any other external things to help. But herbal medicine such as nutrition supplement, they just balance your yin and yang, such as some people feel really hot, thirsty, feel restlessness, very, anxious, and we use some balance and calm down, and herbs calm down. But some people feel very cold, extremities cold, and the body is cold. We try to use some warm conditioned herbs to heat up, to warm. So that's why I use herbs to balance your internal yin and yang.
Interesting.
So it's a little bit different, yeah.
And is the idea that you try to achieve balance immediately, and then you sort of do repeated therapies to maintain that balance, or is the notion that you can sort of achieve balance sort of, only for a period of time, and then you have to keep,
Actually, the
rebalancing?
body just like a car. Of course, you need the maintenance. But if you have some urgent problem, sometimes work just immediately. But after that, you may have this problem, happen again. So we encourage you, and you still need to continue to take care of yourself, such as your lifestyle, emotion balance, your nutrition, food balance, and to balance your body.
So do you find that that's a conflict? Because Western medicine tends to be, doc, fix me now.
Yeah.
Whereas, what you're describing is really about finding some harmony and some, balance.
Yes. So that's a lot of patients will be ask us, why will we be, I cannot eat this food, because Western medicine doctor never told us. So we say no. If you have cold condition, don't eat ice cream, and if you have like a dampness, and don't eat much dairy food and cheese product. If you have too much hot in your body, and don't drink much like hot spicy food like a cinnamon product. So the people right now start understanding, and this is also part of the Chinese medicine. And I think the great things the Chinese medicine can complementary with the Western medicine. Western medicine maybe focus on treat some poison, bacteria. It's focused on the really fast work. But Chinese medicine maybe work other side for internal, your body original condition and constitution. So I think from my experience, it's best in Western medicine, and the traditional Chinese medicine should be complement and integrate.
Oh, interesting. Yeah. Before we go into our demo session, is there anything that our viewers might want to know if, say, they're interested in becoming an acupuncturist or a practitioner of Chinese medicine? What would they need to know?
You mean for a patient?
No, for somebody who wanted to become an like you.
Yeah, first I think you need to finish all of the pre-med program. You have qualification, go to the acupuncture school. Acupuncture school in Oakland, we usually provide a 4 years master level program. After you pass this level, and probably you can take the stable license exam, and then you can get a license. And in California, we have almost more than 10,000 licensed acupuncturists. So we suggest if you have problem looking for the alternative medicine doctor should be looking for some licensed practitioners.
Okay, thank you. Very, very good information for people who are interested in perhaps practicing in alternative medicine. Now we're going to go to a demonstration of acupuncture, and to let people see what we're talking about when we're talking about these practices.
Hi, my name is Gregory Ross. This is Beulah Spivey. I'm an acupuncturist at the Highland Hospital Chemical Dependency Unit, and Beulah is a county employee who has agreed to receive a demonstration of the detox acupuncture treatment. She has no addictions other than coffee, correct?
That's right.
Okay. And it always starts with alcohol to clean the spots. If you could just turn your head a little. Thank you. And then stainless steel, surgically stainless steel, and needles are used. They're all sterile. They've been sterilized at the factory, and they're used one time only. And then after that, they're disposed of in a sharps container. The treatment the treatment as I do it always starts with one in the forehead called Yin Tong, which helps the lungs expand, also helps the body to release endorphins. You can look straight ahead now. And this one called Shen Men, which means spirit gate in Chinese. It also helps endorphins to be released in the body. That one's called sympathetic nerve, which helps your body to relax without using drugs or alcohol. And then a point that's called the 0 point or the balance point, because that's what we're trying to do, bring everything into balance. If you could just look towards me a little. I'm sorry, look around. And then a kidney point, a liver point, and a lung point, because those are the detox organs of the body. They're the ones that have to take all of the toxins and poisons out of our body, and they got plenty to do just the way it is. You add drugs and alcohol, they're way overworked.
Wow. Gregory, now you have been doing this for a long time, but in the setting of chemical dependency, which is fascinating. Tell us a little bit about how you got into that and how these two things work together.
I got into it when I was actually in the acupuncture college. One of my fellow students had studied at Lincoln Detox Center in Lincoln Hospital in the South Bronx, which is where acupuncture detox in America sort of began. And she wanted to create something like that here on the West Coast. She graduated before me, connected up with Bayview Hunters Point Foundation, and brought acupuncture there. And when I graduated, she hired me to work there. And then an opportunity came for me to actually bring acupuncture to the 14th Street Methadone Clinic, and I went there, and eventually through various channels I ended up at Highland as well, which is where I'm at now, have been for 15 years. So it was this sort of idea that I could actually do acupuncture in a community that would never really get acupuncture, and that appealed to me a lot.
Well, that's fascinating. Now, what is your typical patient like? What kind of problems does your typical patient bring to you?
Well, first and foremost, a chemical dependency issue, drugs, alcohol. Secondarily, most of the people that are served at Highland are medically indigent, so they bring poverty and all the issues that come with poverty. And there have been some studies that have shown that something like 70% of the people who have chemical dependency issues have also been abused at some point in their life. So there's those issues. The program began actually as a program for pregnant women and women with children. But that granting thing sort of changed, and now we have a very broad spectrum of people, men, women with children, men with children who have custody of their children. But the underlying thing for everyone is, because it's a chemical dependency unit, is a problem with chemical dependencies.
And these are outpatients, meaning they go home at night and they come in during the day for therapy. So do you see them daily, weekly, and for how long? It's
a 4-day-a-week program. I see them every day that I can get them to come in. The acupuncture is a voluntary part of the program. So a major part of my job is to try and convince people actually to do the acupuncture, or at least try it. But what I always try and convince people to do is to get acupuncture every day. I mean, generally the rationale I use is you used every day, or if you didn't, you were trying to, so do the acupuncture every day, you know. And they, they fit it into their schedule of groups, one-on-one counseling, and all of the other classic parts of a program.
And so I guess the $64,000 question is, does it work?
Yeah. Yes, it does. But people always want you to give a number, well, what percentage? And it's very difficult. First of all, it's a difficult population. They're not compliant generally. And second of all, it's not a cut and dried thing. It's not like, it's a process. Recovery is a process. So even with people that you have successes with, they might relapse, and you might have to do it again. So my answer is yes, it works. What I usually tell people is I've been there 15 years, they wouldn't keep me around if I wasn't doing something right, if it didn't work in some way. And it's been in America, used in America since around 1974 when Lincoln Detox started using it. And it's spread all over the place. So I know all of that is not double blind. There are double blinds now, but if it didn't work, it wouldn't be as widespread as it is. I wouldn't be sitting here talking to you.
Dr. Liu, any thoughts on that?
Yeah, for my philosophy, from my personal experience and also my clinic, I find if we understand the Western medicine, and also we try to, because I was also teaching MD, learn the Chinese medicine, and we can work together, it's more beneficial to patients.
Mm-hmm.
Yeah, we have a lot of samples. We can work together. Yeah.
Okay. Go ahead.
And I'd like to say, with the clients, the acupuncture, I'm not confined to just the detox treatment. People come in, they have pains.
Yes.
They've usually hurt themselves physically in some way, which is always a good thing, good for me in that I can help reduce the pain. Toothaches are great. You can get rid of toothache pain for days and days and days.
Okay, well, that's what we have. So I hope you've enjoyed it. We've just skimmed the surface of this fascinating topic, and that's what we try to do in the public health, to get you engaged. Hope you enjoyed it.